As a board-certified urologist with over 3 decades of experience, I've witnessed a troubling pattern among men in their 60s, 70s, and beyond. These aren't losses to heart disease or cancer, but to a gradual, silent decline in their masculinity, confidence, and vitality, often tied to habits they never thought to question. Private moments of self-pleasure, which they assumed were harmless, can slowly erode their physical health, emotional well-being, and even their relationships. I'm Dr. James Carter, a professor and urologist dedicated to helping older men preserve their sexual health and dignity. While masturbation can be a healthy part of life when done thoughtfully, habits that worked in your 20s or 30s can backfire after 60, quietly impacting your circulation, hormones, pelvic health, and energy levels. In this video, I'll reveal the 5 critical masturbation mistakes older men often overlook, the real consequences they face, and practical steps to reclaim their vitality. One mistake in particular, number 3, is silently undermining the pelvic health of men across the country, and it's rarely discussed. Let's dive in and explore how small changes can make a profound difference in your life as you age. If you're committed to maintaining your performance, protecting your manhood, and aging with confidence, this may be one of the most important messages you'll hear this year. Mistake number 3 is quietly destroying the pelvic health of older men nationwide, and almost no one is talking about it. If you're serious about safeguarding your health and vitality as you age, make sure to subscribe and turn on the notification bell for more science-backed tips designed specifically for men over 60. In the comments, type 1 if this topic resonates with you, or 0 if it doesn't. Your feedback helps me tailor these videos to your needs. Let's get started with the first mistake, one that subtly diminishes sensitivity, dulls arousal, and leaves men wondering why they no longer feel the spark they once did. Mistake 1. Over-Reliance on pornography as an emotional crutch. The first mistake is turning to pornography, not for pleasure, but as a way to escape emotional discomfort. I vividly recall a 68-year-old patient, a retired engineer named Paul, who came to me after losing his wife to cancer. He admitted he didn't watch porn for excitement anymore. It was a way to fill the silence in his empty home. "It distracts me from feeling alone," he said. This is more common than you might think. Older men using pornography to cope with loneliness, boredom, grief, or even a fading sense of identity after retirement. On the surface, it seems harmless, but over time, this habit rewires the brain in damaging ways. Pornography floods the brain with dopamine, the chemical tied to motivation and pleasure. With frequent use, the brain becomes desensitized, requiring more intense stimulation to achieve the same effect. This leads to what I call desensitization burnout, where natural arousal, whether from a partner or your own body, feels flat. Erections become less reliable, intimacy loses its spark, and men start to feel disconnected from their masculinity. I've seen men in their 70s who thought they were too old for intimacy, when in reality, years of overstimulation without emotional connection had dulled their sensitivity. For Paul, the impact was profound. He described feeling like a stranger in my own body, unable to enjoy intimacy the way he once did. The price of this mistake isn't just physical, it's emotional. It's the loss of that vital spark that makes you feel alive and connected. The good news? This can be reversed with awareness and intentional changes. Start by reducing porn use gradually, replacing it with activities that engage your mind and body, like reading, exercise, or meaningful conversations. Reconnect with natural arousal by focusing on sensation without external stimuli. It takes time, but I've seen patients regain their sensitivity and confidence within weeks. The next mistake, however, isn't about the mind, it's about a physical habit that harms blood flow and performance, and most men are completely unaware of it. If this message is resonating, type 1 in the comments to let me know you're still with me. Now, let's move to the second mistake that too many men overlook and pay a steep price for. Mistake 2. Ignoring blood flow, the silent circulation killer. The second mistake is neglecting blood flow, a critical factor in sexual health that many older men ignore. I once had a patient, Richard, a 73-year-old military veteran, who walked into my office convinced he had erectile dysfunction because of old age. He said it like it was a life sentence he had to accept. But after asking detailed questions and running simple tests, I realized age wasn't the issue as circulation was. Your penis is one of the earliest indicators of cardiovascular health, requiring strong, steady, oxygen-rich blood flow to function properly. When that flow is compromised, the effects show up downstairs first. The body is smart, it sends warning signs early if you know how to listen. Unfortunately, most men over 60 don't. They continue habits like quick, aggressive masturbation, often without preparation or care. No warm-up, no deep breathing, no circulation-boosting techniques, just friction. Richard admitted he masturbated fast, just to get it over with. That phrase stuck with me. This mechanical approach, repeated over years, can compress blood vessels, reduce tissue oxygenation, and damage the structures critical for intimacy. Blood vessels stiffen, nitric oxide production, a key driver of erections drops, and micro tears in tissue reduce responsiveness. The damage isn't always painful, but it's progressive, and the longer it goes ignored, the harder it is to reverse. The price isn't just physical. Richard shared how his confidence took a hike, avoided intimacy, felt disconnected from his body, and even stopped looking in the mirror. This is a story I hear too often. The good news? You can improve blood flow, even in your 70s or 80s. Start with gentler techniques. Slow down, use lubrication to reduce friction, and incorporate deep breathing to boost circulation. Regular exercise, like brisk walking or yoga, also supports vascular health. Richard started these changes and, within months, reported stronger erections and a renewed sense of vitality. But even men who address circulation often miss another critical PCA muscle group, essential for stamina and control, that's wasting away unnoticed. If you're still watching and finding these insights valuable, drop a 1 in the comments to let me know you're engaged. Let's uncover the third mistake, one that quietly drains more than most men realize. Mistake 3. Skipping pelvic floor engagement, the forgotten muscle group. The third mistake is neglecting the pelvic floor muscles, a hidden foundation of sexual health that most men don't even know exists. These muscles, located deep in the pelvis, control erection strength, ejaculation timing, and bladder function. Yet, most men have never trained them or even heard of them. I remember Walter, a 66-year-old former truck driver with a commanding presence, who came to me struggling with weak orgasms and unpredictable urinary urgency. He thought it was just getting old, but the real issue was pelvic floor atrophy from years of passive habits, like masturbating in a slouched position while watching a screen, with no awareness of posture or muscle engagement. The pelvic floor is like the engine room of your sexual function. Without intentional use, these muscles weaken, leading to softer erections, less intense orgasms, and even bladder issues. Over time, this creates a cycle of declining confidence and performance. Walter was skeptical when I introduced him to pelvic floor exercises, like Kegel simple contractions you can do anywhere. "You're telling me this little move can fix all that?" he asked. I told him to try it for 2 weeks. Contract the muscles, like stopping the flow of urine, for 5-10 seconds, release, and repeat for 5 minutes daily. When he returned, his grin said it all. "Doc, I feel like I've got my engine back." To engage your pelvic floor during self-pleasure, sit upright or stand, focus on contracting these muscles rhythmically, and avoid slouching. Combine this with daily Kegels to rebuild strength. I've seen men in their 70s regain control and confidence with this simple practice. But even those who strengthen their pelvic floor often fall into another trapone that drains their energy without them noticing until it's too late. If you're still watching and finding these insights valuable, drop a 1 in the comments to let me know you're engaged. Let's uncover the fourth mistake, one that quietly drains more than most men realize. Mistake 4. Not tracking frequency, the hidden energy drain. The fourth mistake is failing to track frequency, an energy drain that catches men off guard. I often ask my older patients, "How do you feel after self-pleasure? Not during, not before, but after?" The room gets quiet. Some say, "Fine, I guess," but the honest ones admit something deeper: tired, empty, like I gave something away. That's not just a feeling, it's a warning sign. As we age, testosterone production slows, recovery takes longer, and nutrients like zinc and dopamine become less abundant. Yet many men continue habits from their 30s, masturbating daily or near daily out of routine, not pleasure. Take Gerald, a 72-year-old patient, healthy and sharp, but constantly drained. He assumed it was aging, but he admitted to masturbating every morning as he had for decades. I explained that what worked at 35 might be burning him out at 72. Ejaculation requires significant energy, physical, hormonal, and neurological. Overdoing it without proper recovery can sap motivation, flatten mood, and erode drive. Gerald didn't notice the toll at first, but over time, he felt less energized and emotionally disconnected. The solution isn't to stop, it's to become intentional. Track how you feel after self-pleasure. Notice patterns. Experiment with spacing tree 2 or 3 times a week instead of daily. Ensure you're eating nutrient-rich foods, like nuts or leafy greens for zinc, and getting enough rest to replenish what's lost. Gerald cut back to 3 times a week and reported feeling recharged within a month, with sharper focus and a stronger sense of vitality. But even men who adjust frequency often miss the final, most transformative mistake one. That's not about technique, but about mindset. Mistake 5. Treating self-pleasure like a chore, not a ritual. The 5th mistake is approaching self-pleasure as a mindless habit rather than a meaningful ritual. I once asked a patient in his late 70s, Henry, about his routine. He chuckled and said, "It's like brushing my teeth, just something I do." That mindset captures a common issue. What starts as a moment of release becomes automatic, devoid of intention or connection. As we age, the body craves presence, but treating self-pleasure like a task leads to diminishing returnsless sensation, weaker orgasms, and a growing sense of disconnection from your own body. Henry, 75, came to me feeling disconnected during self-pleasure, like he was watching it happen rather than experiencing it. This isn't just about pleasure, it's about intimacy with yourself. Without intention, the nervous system doesn't fully engage, circulation suffers, and the emotional benefits fade. I asked Henry to try a new approach. Slow down, remove distractions, like screens, and treat self-pleasure as a ritual. Focus on breathing deeply, engaging the pelvic floor, and being present with the sensations. 3 weeks later, he returned with a quiet smile. It felt different, like I rediscovered something I'd forgotten. To make self-pleasure a ritual, set the stage, dim the lights, play calming music, or take a warm shower beforehand to boost circulation. Move slowly, use lubrication, and focus on how your body feels. This shift rewires your brain to associate self-pleasure with mindfulness, enhancing sensation and emotional connection. I've seen men in their 80s regain a sense of vitality and confidence by making this change. It's not about chasing a fleeting high, it's about honoring your body and keeping your inner spark alive. Conclusion: reclaim your vitality and masculinity. For over 30 years, I've sat across from men in their 60s, 70s, and 80s strong, wise men who've built families, careers, and legacies. Yet, in the privacy of my office, many confess a quiet fear. I don't feel like myself anymore. Not because of illness or loss, but because of a slow erosion of vitality they can't quite pinpoint. Time and again, we trace it back to these 5 mistakes: using pornography as an emotional escape, neglecting blood flow, ignoring the pelvic floor, overdoing frequency, and treating self-pleasure as a lifeless routine. Each chips away at physical strength, emotional connection, and the rooted sense of manhood that defines who you are. It's easy to dismiss these habits as just what I've always done, but what worked at 25 can quietly harm you at 65. That's not weakness, it's biology. Your body is asking for wisdom, intention, and care. I think of a patient in his early 70s who believed his best days were gone. After making small changes, reducing porn, slowing down, engaging his pelvic floor, and tracking frequency, returned weeks later and said, "I feel like I've woken up again." That's what I want for you: restoration, not restriction. Start today with one change. Try a pelvic floor exercise, reduce porn use, or take a moment to breathe deeply during self-pleasure. Observe how your body responds. There's no perfect formula, but there's a better way, one rooted in awareness, health, and dignity. Your age doesn't define your masculinity. How you treat yourself does. It's never too late to choose differently. Stay with me for my next video, where I'll walk you step by step through a mindful self-pleasure practice designed for men over 61 that supports your circulation, hormones, and inner fire, keeping you strong and vibrant for years to come.